Good afternoon to you from the News Channel 5 studios. We're jumping onto Facebook this afternoon. We'll post this up on YouTube a bit later as well, but I want to welcome in right now Dr. Ramprasad Gopalan, an infectious disease doc who has been in the thick of it throughout the entire pandemic, the last 15, 18 months now going on. And we're talking this afternoon about the CDC's updated recommendations for vaccinated individuals now to re-mask up. That coming out of the CDC late today, Dr. Michelle Walensky, the head of the CDC, suggesting that there's some new science that has come out with regard to the research they're finding from the Delta variant internationally, really, is what she said they pulled on to make this new recommendation. And the additional recommendation, which we'll tackle in a moment, but just to mention it right off the top, is that everyone, K through 12, in schools across the country in high or substantially areas of high or substantially high transmission levels of COVID-19 would also mask up coming for the fall calendar here. So Dr. Gopalan, thanks so much for being with us. And what do you make of these new recommendations? And just to be clear and clarify, this is for high or substantially high transmission areas of the country, which makes up about, we're estimating 2/3 of the country right now.
Yes, unfortunately, most of these things could have been prevented. Let me put it out there. We have vaccination available in plenty in every street corner drugstore. And we are here, unfortunately, many countries around the world will give the right arm to get a vaccine. Having said that, now, the CDC came out with this recommendation, which reversed their earlier recommendation. Well, this is based on the fact that even vaccinated individuals can transmit, virus. How did they found out? The people who, there is some vaccine breakthroughs, what we call, as in life, nothing is 100%. People who are vaccinated, very few of them can get the disease. But the rate of what we call viremia in them is as equal to the other unvaccinated individual. This is not everybody. Let me put it and clear. This is not everyone. There are select individual few who can, do this. So since the guideline was for every vaccinated individual without differentiating, there are certain people who can exhibit these signs and transmit virus. Now the CDC has come out and revise this for the protection of everybody, because even in a gathering when they say all vaccinated individuals, how often do you see there are plenty in the group or not? It's never 100% there either. So that's where they got the recommendation to say indoors in closed spaces, please mask up even if you're vaccinated because of that risk.
And so talk to us about what you are seeing in South Florida specifically, and we'll get back to the science. Excuse me for a moment. We're live right now, and I needed to do that. I apologize to you. But talk to me about what you're seeing in the South Florida community. Have you seen an increase in the infectious disease cases you're seeing here in the community? Yes. If we could see the video, I need to take a quick sip of water, please. Thank you.
As you said, I'm in the thick of it. And unfortunately, a few weeks ago, we had few patients. And I was, getting ready to take a breather and be relaxed. And all of a sudden, we have, unfortunately, full house with people waiting in the ER. And my first question, to them was, are you vaccinated? 99, 98, 97%, more than that, are unvaccinated. And there is no reason for that. And I have few vaccinated patients. In fact, a 99-year-old who got the disease, who was vaccinated, got treated, went home. People, there are the population of people who are really, really getting affected are between 20 and 50, and they are really sick. And some of them have and the majority of them are young, less than 50s. Although we have few outliers, but young patients are getting sick, and they are a lot sicker. And, now you see the family, husband, wife, kid, they're all in the hospital. Husband, wife, baby in the hospital. Okay. So you're seeing these, which is a norm rather than an exception. Before it was an exception. You would see one or two members of the family in the hospital was kind of there, but it's not. Now you see, oh, my husband is next door, yes.
So for those who maybe are frustrated by the change in rules, understanding to your point that when science changes and rules change, and that was what was presented to the public today by the CDC, is that the science has changed Delta variant is behaving differently, were the words that they used to explain it to the layman. Perhaps we can glean a little more information. You help us understand, how is it behaving differently exactly? Because it was our understanding, quite honestly, that the Delta variant, while it was more transmissible, it was not as deadly, and that was just a couple of weeks ago. So did we get it all wrong? I mean, it is a bit frustrating to the public with, the lane changings, changing of the lanes here, albeit we haven't been down this road before.
Okay, I mean, it is highly transmissible, as we all knew. And well, not deadly was not one of the forte where they projected, but it was as high infectivity rate was one of the hallmarks of that. See,
Okay.
what we have to do is we have to look outside, around the world and see what happened there. There are certain countries where a few months ago they had no COVID cases, and all of a sudden, especially in India, they all went through a sea of, I mean, if I want to say it, like an avalanche of cases. What happened? Because we exactly what's happening to us. People left their guard down. People took off their mask. People started congregating. And at the perfect storm arrived Delta variant, which was highly transmissible. And there it is. So now we are in the thick of that, and we could have learned from that. What I try to tell everybody, this is not a political statement. This is not a right, left, center. It is your own health and your choice and your family's safety. It is nothing to do with anything else. You got to listen to the science. Why is the lane change? Viruses mutate. That is what they do. All viruses, they mutate and they acquire things what is advantageous to them. So among the everyday mutation, there comes a chance of hitting a lottery. For lack of better words, it hits a lottery for that, and then it is bad for us. So then it acquires things what it can cloak the immune system, and it can develop resistance to, or it can evade the immune system. So even go ahead.
No, I want to ask you, a viewer's throwing in this question. So if the Delta variant, you say it's presenting differently, it's not behaving the same as, a year ago, the virus when it presented a year ago, why are vaccinated people getting sick if they're vaccinated? Because we are starting to see, like you mentioned, those breakthrough cases. Why is that happening? That's coming from Julie Khanna today.
Okay. The vaccinated people with the Delta variant, do have a good bit of protection. It is not 100%. Even with the regular strain, what we had before, remember it was 95, 96, 94. There are still a whole select population where there were, you could have breakthrough. That is norm for anything. So is true for this one. We may get a booster, shot which is directed against this. By then the virus may mutate. Who knows? But I hope not. But yes, we do get sick because the vaccination protection is not 100%. But don't make no mistake, it is highly protective. As I told you, a 99-year-old fully vaccinated person was sick but could go home, within a short course of period. So are people who are vaccinated are less sicker, and majority of them don't need anything. And I have a whole slew of people who got infected in a closed system. I'm not going to name that system or the community. They were all young, between the ages of 20 to 28, young, healthy, vibrant. And in there, more than 60% of the individuals were not vaccinated.
Okay.
And the rest of them who were vaccinated did get sick, but their sickness lasted like a little sore throat, and the next day they were back in their remote working. And the rest of them who are not vaccinated, who are the same demographics, are still lingering, having symptoms, and they're sick, not back to work. And some of them are hospitalized too. So with that in mind, you can see that small microcosm of people vaccinated versus unvaccinated. You can see right there, straight in the face. So yes, people who are vaccinated can also get disease, but their severity will be lower. Hence the recommendation, please go get vaccinated.
And the recommendation specifically today, if you're just joining us out of the CDC, is in areas of high or substantially high transmission levels of COVID-19 presently. They're now recommending even those vaccinated go out and now mask up if they are indoors, and now also in CDC updating, also saying that everyone K through 12, teachers, students, visitors, should all be masking up for the fall. So who exactly are we protecting here in this? If we're vaccinated, it was our understanding up until now, the general public assumed that we would not be spreaders. Are we to believe now or understand, based on the CDC updated recommendation, that that was wrong, and we are now finding that we can be spreaders of the Delta variant? Is that what that's what I understood out of the press for today?
First, question number one, who are we protecting? Unfortunately, we are not in a level of certain states where the vaccination rate in certain counties exceed 90% and 98% up north. You can see the level of hospitalization in those places, very negligible. There is a stark contrast between the communities which has the highest immunization rate versus the communities with pretty low dismal immunization rate. That's the proof is in the pudding right there. And number two, we are protecting the people around us when we come back. We, as a community, are not fully immunized and protected yet. We're not reached the herd immunity by any means. So now, what was thought of before the Delta variant was once you're immunized, you're not going to get the virus, you're not going to carry it, you're not going to spread it. But as I said before, now we know there are select individuals who can carry the virus at the same level as unvaccinated, but not everybody. There are few who can do that. And if you get infected, you may transmit. So you are in a safe zone, perceivably safe zone. Now you can transmit that to other people. So that's what the problem is. Hence the new recommendation, as the science evolved, we get, protection level where it's needed to be masked.
Dr. Gopalan, a question coming in from the
Yes.
folks who are jumping on with us. Gloria Bischiari says, "Are kids catching it?" And I believe you just answered that. You are
Yes.
seeing, are admitting children now? Are we talking ICU? Are they on oxygen? Are you venting them? Where are we? Let's talk regionally, because I know that's what your area is.
Well, I, unfortunately don't take care of the kids personally myself, but, we are seeing uptick in pediatric population, uptick in severity index in the kids who are getting admitted to the hospital with this variant. But, in fact, I have a patient whose, son who's 5 years old is in a different hospital because the hospital where she's at doesn't have the pediatric facility. So yes, this is affecting the kids, and hence the recommendation, the K through 12, to wear masks, and teachers and kids, vice versa, visitors, to protect everybody because they're the ones who go home.
Right. I saw a question a moment ago, and I can't quite find it in the comments section, but I'll kind of summarize it for you. Somebody asked, I had COVID. I've also gotten the vaccine. I feel like I'm protected. Do I still need to be concerned here? Can I catch COVID again? That was the question. Can I catch COVID again? I've had it before. Now I have the vaccine. I feel like I'm protected. Can I get COVID again?
Your chances of getting a severe COVID is very, very low. But can you have a disease can you get, once the protection level drops off, each body responds to disease, vaccine differently. So, depending on your level of immunity your body made and the vaccine gave you, hopefully that should be enough. But can you catch it? Yes, there is a possibility that you can, but the case of severity will be very low until, science proves otherwise. So far as this point, it is very low. And that is the message we're driving home, is like, you will not be sick and you will curtail this, wave very quickly if you were immunized. And yeah, that's the message. Please get immunized. And when you see outside, people left caution to the wind, basically. And you all you have to do is look outside the borders and see what happened to the countries where the wave they had it all under control and it went haywire. What happened? This is exactly what happened. We don't want to follow, there is a precedence out there, and we just have to put a break to that.
What about folks who have natural immunity? There's been a lot circulating in the last couple of days. I had COVID. I have my antibody count was good on my last blood test, and so because the discussion really is vaccinated versus non-vaccinated. But if you have natural antibodies, what are your thoughts on that, Doc?
Yes, your natural antibody wanes after 3 to 4 months. That's when the recommendation is to get vaccinated, because your immunity has waned. At that point, you may become vulnerable. We don't know the exact time the natural immunity lasts, but the guidelines is somewhere around 3 to 4 months. You better get immunized again to have the protection last longer. Yes, your natural infection gave you certain amount of immunity. And see, the whole thing is about breaking the cycle of transmission. So if you have this thing keep going in this community, keep going in the community, we can't break it. So hence the wave. So by the time your immunization, status or your immunity wanes by natural or by vaccination, now you're ready for the next cycle because somebody else is propagating this all around. So if all of you are immunized and all of you have good amount of immunity, herd immunity, and by vaccine or hopefully by vaccine, you'll break the cycle right there, and then there is no chance for propagation. So that's how these diseases break and die. So that's in our hand.
Do you worry that with the recommendations today out of the CDC, that part of the drive of getting people vaccinated, and again, just to remind our audience that you're an infectious disease specialist, so this is your field, since nobody's in it more than you are right now. Do you worry that the message out of the CDC used to be, go get vaccinated, you can get back to your life, you can unmask, you can be free to associate with others and feel comfortable? Do you worry with this recommendation today now that our kids, whether they're vaccinated or not, when they return to school, our teachers, whether they're vaccinated or not, when they return to school, now they have to mask up? Do you feel like it disincentivizes those who have been kind of waiting, saying, I'm going to wait to see where this goes and wait on the vaccine? Do you worry that might disrupt the flow of people who were considering getting vaccinated?
Okay, here is how the message from the CDC should, portray to people. Get vaccinated because your chance of severe disease is way, way, way lower. You do not want to be in the hospital with this disease. You do not want to be ventilated with disease. You don't want to suffer. Because if you are immunized, the chance of you acquiring a severe disease is way lower. Well, your incentive for having a normal life, yes, that is your social benefit. What is your personal benefit of getting vaccination? Well, you don't die. Two, you don't get severe disease. You don't want to suffer from this disease. This is not something nice to have. Having seen thousands of these, people who are afflicted with this, it is not a thing to even have it. Now we have a way and means to prevent it. How did we eradicate a lot of, world maladies like polio, smallpox, everything by vaccination? So is it 100%? Is it all, pluses? There is nothing in life is 100%. So this will help you personally avoid the severe disease. So there is a big benefit of you as an individual. Forget the society part of that. Just think of you as a person. What is it in it for me? Yes, you will avoid. So there is the biggest benefit to go get vaccinated. Yeah, maybe you may have to mask up, but you know what? You will be there fully alive to mask up. At least you will not be in the hospital. You will not be in the, having the disease. So that is the biggest benefit of the vaccine. Yes, this has a little variant, got the, breaks for the social aspect of, life. But hey, this is what the message should be. As an individual, you will be protected against severe disease and having you to go to the hospital, There is, as with anything, 100%, I say there's nothing, but you will be protected.
Sharing from the comments section, Mum Fallon La Balbo asks, do you recommend folks who had tested positive a number of times for COVID and were never really sick, they feel they don't need to be vaccinated, should they be?
Yes, after you've been tested, within a couple of like 3 to 4 months, your antibody level drops off. The recommendation is to get vaccinated around there. And especially with the new variant, these two vaccines, what we have has afforded a good bit of protection against even Delta variant. But again, remember, what we're talking about is the people who carry this virus and pass it on. They may not be sick as a dog like others, but they can still propagate this. This is a new information which, we have gleaned. Before the old variant, you didn't transmit because there was very, very low rate of anything transmission to others. Now with this, we can transmit, but remember why you have to get vaccinated. You as an individual are protected. Maybe the mask, why? Because you can transmit that to the others too. And you don't do that as a society. We keep propagating it. So that's where we have to break it.
Talk to me a little bit about, Doctor, you talked about at the very beginning, the last couple of weeks, and this kind of quick surge is, I think, how you described it in the hospitals. And if you will speak a bit about the fatigue that you feel like your colleagues may be facing. I mean, this is a long time. We talk about firefighters going out to the battle lines, and then they put in reinforcements and kind of pull them back and send in other teams from across the country when we're battling a fire. What would your message to our audience be on behalf of maybe practitioners, healthcare providers across South Florida and really the country? Where are you guys in terms of fatigue on this?
Well, people are just, becoming a little complacent, because the other day I was rounding in one of the hospitals, and then I turned around and I said deja vu, because we have the COVID floor extended way beyond what it was, just reminiscent of what it was before. It's getting there. And then, there was another dog we passed by with full gear, everything. We just nodded because we did this too many times before. Now we just looked at it. I said, we thought we're not going to see this. Now it is extending, beyond what it was. And, this wave is a little different because most of them could have been prevented. Most of them, we feel, looking at it, we say, if you have questions about the vaccine, if you have information deficits or misinformation, don't ask Uncle Joe. Ask the doctor, ask the right people. Hey, and people say, oh, I take the vaccine, I heard, I won't get pregnant, or I have some issues with my pregnancies. No, it does not. It's an mRNA. That's a major, issue in a childbearing age. Or do I get, other conspiracy theories? There is nothing. This is a vaccine. This is done for the greater good of the people. Look, leave all politics aside. I'm not right, left, or center, or anything. It just protect yourself. Who's most important person here? You. You are the first person. You protect you and your family. Nobody else. When you're sick, the person who told you, whether it can be a politician or whoever, doesn't come next to you to comfort you. Here's the sad part of that is some of the people who are making these are immunized themselves, and their family is protected. And I strongly urge the people to, send the message, all party, everybody. This is us as an American people. We have to be together to get this thing, controlled.
Samantha Marks asks, and we'll take a question or two more. Appreciate your time so much this afternoon on this. But Samantha Marks asks, what if the vaccine rates do not go up? In other words, to my question earlier, people don't go and get vaccinated. What happens then, in your estimate?
Well, unfortunately, you would see this thing continuing on and on and on. And, what happens is we're going to give not only Delta, this virus gets smarter. Down the lane, maybe a next one. By the time we make another booster, for example, we may make another booster and say, here's the booster. But if you don't break the cycle of transmission, if there is not enough bodies to this to go around, it'll keep, mutating, and then one day it'll hit the lottery again. So
So
then who
that
knows?
is what happens from the disease process development standpoint is we gave this enough time to breathe, in
No,
essence.
it's circulating because we didn't cut it down to the point where there is no fire. The fire is smoldering, 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 and there is nobody douse the fire because there is, water cannon to douse the fire in the form of vaccination. We didn't do it. Now, one little blip, it ignites again because now it caught, new route of, timber. So that's what we are. Unvaccinated people give more, credence to this fire spreading. So if everybody's immunized, where is it going to be? It's quelled and it'll die down, and there is no reason for the fire to smolder again. So if people don't get vaccinated, we gonna be in the long haul. Young people who think they can have the normal life. Remember, this was the first incentive was to get vaccinated so that we could get back to life. But life changed a little bit again. This put a curveball. So now this is a time to double up for the vaccination so we can curtail it, because who knows, maybe in next variant we may not be that lucky to get this vaccine working. We may have to do ground zero again. So we don't want to give that, and then who's to blame for that? So this is where our push and emphasis. I urge people who are on the fence, if they have questions, ask the right people, not the Joe Schmo who does not have any background, not the conspiracy theorists, not ask the right people. Nobody is giving out information, from a credible source to misguide you. Every scientist with a, worth of salt will have, their thought in all the good direction for the people. That means, they want to help the people. So ask from the credible source if you have any kind of misconception, because remember, the whole goal is to protect you, your family, community comes next. First you do. First you as an individual. Just think about you. And what am I getting from it? Oh, I'm young, I'm not going to get sick. No, that is not true anymore. It is not true. All I have is 20s to 50s with no comorbidities, nothing. They're sick. So they can. Let alone now, how do you feel? Your 5 and 8-year-old child, you went to work at a party and then you came home and you gave it to a child. Now the child is sick and, the child is in the hospital. I mean, see, please, that's where the thing is. Vaccinate. And
Final question for you, Doc, as we wrap up this half hour, and we appreciate your time so much. When you report to your hospital, and as you mentioned and described a few minutes ago, the COVID floor maybe that was designated the COVID floor 6 months ago had perhaps shut down or diminished quite a bit, and you walk in and you're confluent, you're overflowing with patients again. What does that do to you as a practitioner?
well, it takes a mental toll. It's not like you're just walking into patient's room, walking out, and each one has a need, and you are masked, gowned, shielded, and you're walking in. It is not just in and out. It's a process, and and then patients are scared, and they take time, and for you to explain to them, each person takes a lot of your time and effort as a team. Everybody as a team, they are giving their time. But once you know that some of these could be prevented, now, and then you are putting yourself also at risk. How many of my colleagues were sick, and there are colleagues who are not here anymore, because of that. So they, really put themselves first. So now imagine that, there are, a lot of healthcare workers retired after they just couldn't do it. I mean, I don't blame them. I used to get mad once upon a time, but now they we are all reaching to the point of fatigue, and especially when you know that this could be prevented. I mean, you have to have personal responsibility. This is nothing to do with anything else, but just your healthcare provider giving you information. So cut out all the politics, everything else aside, just protect you and your family. Just ask the right question to the right people. Say you still have questions. You know what about this, what about that? There are a lot of credible sources. So even CDC, FDA, they have to change. Oh, why they changed from yesterday to today? Science is evolving, nothing is stagnant, because as and when the information comes, we have to make it. Sometimes it is for the greater good. It is not palatable for everybody. It may be discomfort to some, to say, hey, you told us to get vaccinated, I could go out and have fun, and then I without a mask. Now you're reneging on that. It's not us reneging. It's, imagine if 100% of the society was vaccinated, this Delta variant would not have caught foothold, isn't it? So now probably we could have gone. There are societies in here. See, that's why they said counties and areas of high transmission. That's where they said, all this masking is. There are still areas which are high vaccination rate, almost count. There are some places with 99, 100% vaccination rate in this country, where there are areas. And you look at the hospitalization in the areas of high immunization and look at that same thing in the low immunization. There is a stark difference. Do people need more proof than that? I don't think so, because it shows the vaccination still works.
And
So
once again, go ahead.
we as individuals have first responsibility to ourselves and to our family next. If you think, what is in it for me, like when you said I can't go out with them, no, that is a societal or social benefit. Forget the social benefit. Take off yourself for the health benefit. That means you won't get sick, and you will not make your kids sick. You'll not make your parents sick, if they're not immunized, or, so that's the benefit you're going to get by immunization. You may not go to a club or a bar, as of now, because the transmission is still high. There comes a time, if everybody has, thought process of getting immunized, you'll break the cycle. Then guess what? You'll be back to what you want to do and what we love to do, enjoy open air and free. And please get immunized, and you can enjoy, maskless time should be coming.
And once again, the update out of the CDC this afternoon applies for high or substantially high transmission levels throughout the country at the moment, which does encompass a little over 65% of the nation at this point, including Florida. Dr. Ramprasad Gopalan, infectious disease doctor out of Point Beach, Florida, seeing a lot of COVID, a lot of Delta variant right now, has been on the front lines for us for the last year and a half now. We so appreciate your time today. Thank you for caring for your patients and our community, and for what you've done for our country in this fight. We appreciate you so much.
Thank you, people. Please, if there is one thing in here, please consider getting yourself immunized if you're not. If you still need information, there's plenty of credible information. If you have fears, ask, protect yourself. Thank you.
Thank you, doctor.